Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Okay, Wayne, tell me what's going on with your shoulder. What happened?
I had a right shoulder injury in 2015 and didn't do anything about it.
2015, we are in,
Yeah, had an ATV accident.
yep, February 2021. Okay.
Yeah, and anyway, January of 2020, I felt like my shoulder was good. I started doing a lot of push-ups.
Okay.
Got up to 700 push-ups a day.
Okay.
And
Wow.
was seeing the results in my physique. I liked it.
Uh-huh.
Then I decided I would start doing push-ups to the point of
Okay.
fatigue. It took 3 days and I was hurt. So I had shoulder surgery to remove basically a bony piece that
Floated
was in.
bones. Okay, so you had a surgery because you had floated bones. Okay, what else do you have?
That was October 6th. October 21st, I had a stem cell
So
procedure
you
where I
had
put
stem cell surgery, stem cell. What else? You had massage, chiropractor,
I did
physical therapy.
I did chiropractor massage, deep tissue massage, trying to get some relief. I always got relief, but it was temporary.
Okay.
And now I'm to the point where it's just nagging me. I'm uncomfortable all the time. All the movement. I've got good range of motion. I feel like mostly, but it hurts through all the range.
So how much pain from 0 to 10? Constant pain.
Constant's probably a 2-3.
2,
And then
3. It's
movements
all the time.
all
Okay.
the time, and then movements, depending on the movements, will
Okay.
ramp it up to a 6 or 7.
So a 6 or 7. And what kind of movement did aggravate your symptoms?
Overhead, anything overhead. Well, any movement, but overhead.
Rotation
Even
stuff?
though I can move, and if I'm out like this and rotate, pronate, that really hurts. And I didn't know it until you put me through it, but behind me,
Okay.
all that hurts.
So what kind of pain and where do you feel the pain exactly?
I feel most of the pain in the front. It does wrap around to
Okay.
the back, but most of it
Okay.
is on top of my shoulder and in
Okay.
front of my shoulder.
Okay. All right, so we're gonna do the motion that aggravate your symptoms now, and you let me know how much pain you feel there. Okay. So let's just bring your arm up and tell me how much pain from 0 to 10.
It's only about a 2.
Okay. Let's turn around and bring it back, and
Now
let's turn around so we can see how
that's all I
far.
got, and that's a 5 or a 6 right there.
5, 6. That's really very limited because normally you should be able to touch your scapula or the shoulder plate with that motion. So 6 with that. Any other motion that aggravated?
Out to the side here, and any rotation.
How much from 0 to 10?
That was about a 5 or a 6 right there. Like that movement right there, I feel it all in the top of my shoulder.
5, 6. So rotation going backward. Okay, so we
I just asked if you had any familiarity with whether that TDP far infrared mineral lamp was useful or not. That's what I've been trying to use. It gave me some temporary relief, but then I kind of felt like it was prolonging the inflammation.
That's a problem. Okay. So the body has to go through 3 stages in order to heal. First stage, like think about external paper cut. I'm just gonna use that as an example for the normal healing cycle. So first stage when you have a paper cut is inflammation. That's when you have redness, blood start to rush to that area, increased temperature and swelling. Second stage is a proliferation stage. That's when the body starts to build the scar tissue to heal, to cover the wound. Last stage is a maturation stage. That's when the body actually gets rid of the scar tissue, and that could take days, weeks, months, or years. The problem with what you just mentioned, the infrared, okay, if you're gonna cause more inflammation, that lamp will not break down the scar tissue. So for the scar tissue or fascial restrictions or trigger point, which is actually occur in the second stage, the proliferation stage, you have to have mechanical force to actually break it down. Because when you palpate, and you actually told me, you feel those knots? We need to break. We need to have mechanical force to break that. That's why, like, you have a stem cell. It's not gonna have that mechanical force to break the scar tissue. Some of the treatment, if it causes too much inflammation, it's actually your body has to go to the proliferation stage, which is actually causing more scar tissue. So that's why some patient, if the treatment causes too much inflammation, their symptoms could be worse from the scar tissue that actually built up from the treatment.
I think that's what happened to me, because, you know, the whole process is about triggering inflammation.
So it's kind of gambling actually. It's like, you know, like you come with a cut here, I'm like, okay, this cut is not healing. Let me cut it more so your body will heal. I'm like, just give me the signs for that.
Yeah.
You know what I mean? If you're stuck in the proliferation stage, just move it to the maturation instead of going an extra step that you're actually gambling with the inflammation. Because there is no guarantee that the new inflammation gonna heal the old injury and the new injury from the new inflammation. Does that make sense? Let's make it more complicated actually. So yeah, so that's why I invented those tools, and each tool to work on each part of the healing cycle. So I use, like, for example, this A5, and I'm actually using it to break down deep scar tissue and deep fascia restriction. Make sure it's pain-free, okay? So I'm actually trying. Is it painful?
Yeah, that's painful.
Sorry, what about now?
No, I can handle that.
Okay, make sure it's pain-free.
That's pretty close to a source of all my pain right there. A lot of it is in that area.
Yep, I can feel that's a big knot here.
Big knot. Big
Yep.
knot. Yeah, that's painful right there.
So today we'll know if you're purely stuck in the proliferation stage or you going back and forth between inflammation and proliferation. I'm gonna start initially to work on breaking the scar tissue, release the fascia and the trigger point with ASTR tools. I'm not gonna use the MagnaHeal to work on the inflammation, just to rule out which stage you are in. If you have inflammation, we'll jump to the inflammation protocol, but initially we'll focus on the proliferation for now.
Okay.
Okay. You feel that big knot here? Is it painful?
A little bit. That's not
Sorry.
not quite as sharp a pain as the
So if you feel pressure, it's normal to feel pressure with the tools. But if you feel like, ouch, that's painful.
Okay.
I know you told me you have 2 to 3 like constant pain. So if that 2 to 3 has not been increased with the tools, it's fine. We need to continue working on it. Okay?
Okay.
And the tenderness from touch, it's actually a sign of deep inflammation.
It's
So-
definitely tender.
Yeah, but I don't want to be inflamed more, so you let me know if it's too much. If you feel pressure, that's okay.
All that's fine. You're down there.
Okay. So you had massage therapy, you had physical therapy, chiropractor,
Yeah.
stem cell, infrared surgery. Oh, you have it. You had it all.
Mm-hmm.
Yeah.
I'm out here in desperation. I want to get better. I'm not getting better.
Yeah. And you're from Mississippi.
From Mississippi.
Yeah. Welcome to Idaho. I hope. Well, it's colder here.
I've only ever passed through here. I've never really been here.
Yeah. Well, we have like it's a nice day today actually. It's kind of mild winter.
It was beautiful.
Yeah.
Once you located the first one you touched, I didn't even know that was hurting until you touched it.
Yeah, it's right on that knot. And why scar tissue could be an issue, and you have a lot of scar tissue, because our muscle should act like a rubber band when contract and relax and stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, will not stretch much. That's why you try to move it, and that's especially with the rotation, that actually you need more range of motion with. You start to feel pain. Is that too much?
See what you were talking about when you did the assessment and saw how weak I was.
Oh,
That's-
yeah.
That's what I thought that's the only thing I've gained from resting. You know, they're like, rest it, don't.
Oh, that's the recommendation,
That
rest it?
was a recommendation. All I've
Too
done
much
is
rest could cause frozen shoulder.
I know, and all I've done is
Yeah.
getting it weak, and the things that might support it and help it.
Yeah, I just
not
reassessed his muscle strength, and I did other special tests to make sure there's no tear. before the video, and it's just what stood out is very weak, really weak. Rotator cuff, that's most of your weakness. And when I resist you with the internal external rotation and abduction, you complain of more pain. So the scar tissue gonna actually cause more weaknesses. Think about it this way. Your band is not stretchable to contract, to really resist. So you're recruiting less fibers. Of course you're gonna be weak. That's why. And we can do that. We should have had it in the video initially, but those resistance afterward and see how's your weaknesses. Because sometimes with a lot of patients, when we break the scar tissue, they actually gain the strength immediately because they fire all the fibers to contract. You know what I mean? There was firing issue that scar tissue inhibit or restrict the full contraction of the muscle to exert the force. I know, and you pharmacists, you understand what I'm saying. I hope that's easy language.
Well, that would be great if it gave me full strength.
Yeah.
After.
So of course you have to do some strength afterward,
Oh, yeah.
but
Well,
at least the severe weaknesses that I saw, that I wanted to have more muscle contraction. That's what I want, to have more fiber contraction. You're not having full contraction.
And I want to get back in the gym. I want to get strong, but I'm afraid anything I'm doing is going to be.
Well, we're gonna go over, after the video, I will go over what exercises, how to do it, because I wanna make sure you really do things safely. So you feel the tightness here? I'm using actually your superficial fascia with ASTR tools here. See it in the video. I'm going at least 1.5 inches deep in his chart with the A5. So to release the deep scar tissue and deep fascia restriction with the A5, which is actually impossible with the hand to really go that deep. Is that painful? It's okay.
It's okay.
Okay. So as I mentioned, like for scar tissue, fascia restrictions, it's impossible to release them unless you have mechanical forces that go that deep or go into the tissue to cause the release. That's why it's hard with the massage to really go that deep to release it. And with the hand, you know, it's the therapist will be very tired actually to really exert that force. That with the tool, it's actually very, really, I'm pushing down like I'm not exerting any like significant force, not even like anything. I'm just using my body weight. You know. Okay. Okay. So and I'm gonna show you the map of the scar tissue, and you're gonna feel it really easily here. You hear that grinding? That's all scar tissue. And I feel it in an A3 ASTR tool. It's vibrating here. So that's a way to know how much is scar tissue. And if you don't have any issue with inflammation or like comorbidity like diabetic or high blood pressure or high cholesterol and stuff like that, typically in 1 to 2 sessions, most of the patient can feel the scar tissue is start to shrink. Actually, it's like I'm shaving it. So I know we're gonna do the nutrition evaluation right after this. The length of the time it will take to break the scar tissue is actually indicative of how much deficiency you have internally. So that's why in the program I usually go over nutrition, we'll go over laboratory testing to make sure you're not missing any of the nutrients that required for your body to transition from inflammation to proliferation to maturation, which is normal sequence of the healing cycle. You feel all those knots?
It's all there are, knots grinding.
Yeah. You hear that?
Mm-hmm.
Okay.
You haven't found a smooth spot yet, have you?
Well, it's a little bit in here, smoother. So we have rough and smoother, and very rough. That's very typical if you never had any ASTR treatment, that your body built scar tissue from workout and other stuff and has not been break it down. Most of the patient, they actually start to have symptoms when the scar tissue gets so thick. When you start to build it like 1 to 2 millimeters, most of the people not gonna feel much of an issue. But when you start to have like 1/4 inch, 1/2 inch, that is in the way of everything else.
Will it get so large you can't break it down with the tool?
You can break it down with the tool. You can break it down with the tool. The length of the time of how long it's gonna break it down is determined by how much deficiency you have. That's why I go in all programs on the diet, nutrition, to make sure you're not eating inflammatory food, you know. Yeah, so I had cases that it can be broken in 1 to 2 treatments. Had video for a patient who was like, after we did it, it was just to start to see it smaller, and follow-up video you can see the size shrinking. Initially when I was doing experiment, we were measuring, and we were measuring with the inches. And you will see when we do our treatment, the redness is going to be smaller, the thickness will be.
It is lotion, just to let it glide.
Just to make it glide, this is massage lotion, there's nothing special.
It's not Dr. Jacobs ASTR cream.
No, actually the cream is not what you get the result from. That's why I tell patients just use coconut oil or, you know, massage lotion that's not chemical, you know. There's nothing about it. What is different is if someone has inflammation, I put them on the inflammation supplements. Because lotion is not gonna give you the magnesium or D or C or V that you need it for your body to heal.
And I have had those labs in the past, I just haven't run them lately. And I was
You
low.
feel this knot here?
Yes.
You were low in what?
I was low on D, and we just upped my supplement.
I looked at your D last time I saw it was fine.
Yeah, I had been low, so we upped it, and I got it in a good range. My Bs were low, so
Yeah.
they actually started me on B12 injection.
Uh-oh.
Uh,
Okay. No comment. Just B12, nothing else?
Well, I take a complex.
Okay, you have to take the supplements too.
Yeah.
The B vitamins, all Bs depend on each other for absorption. Taking one and avoiding the other one, you're gonna cause imbalance of the Bs, you know? You're familiar with that, yeah?
Oh, yes.
Yes. So see the scar tissue, there's a knot here, and there's a big knot in here, and you can see the redness where he has the scar tissue. So I'm gonna clean that. So far I worked on the trigger points, scar tissue, fascia restrictions. So we worked on everything for the proliferation stage. So, how does it feel?
It's actually improved.
0 to 10?
1.
Okay. The constant pain or the...
The constant pain is 1.
Okay. And let's do the motion that aggravated. Rotate and we'll go back. How much?
That's still a 3 or 4.
Okay, we were 7, yeah, on that one?
That's
Okay.
a 6 or a 7 all the time.
Yeah.
I still feel that. That's less painful, but I still feel that rotation.
How much from 0 to 10?
3.
Okay. So we are 3 and 4, okay. Alright, so I'm gonna use the MagnaHeal now.
Okay.
So I use the MagnaHeal as treatment tool and actually diagnostic tool. So if you have mild to moderate inflammation, it should take a few minutes with the MagnaHeal to decrease the inflammation. I mean mild inflammation only. Moderate to severe, it's gonna need more time. So we'll see how you feel. And I coated with anti-inflammatory coating here too. So look up nice and tall. So you feel it right in here.
Mm-hmm.
So this is a MagnaHeal 1 and we'll see how you respond to that. If not, I'm probably gonna put the MagnaHeal 2 on you and do the motion. If you have mild inflammation, should be enough with just a couple of minutes with the MagnaHeal 1. If you have moderate to severe inflammation, usually I recommend the MagnaHeal 2. You wear it for a longer time for that inflammation because it takes time to decrease moderate to severe inflammation. So today we'll know you have mild, moderate, or I don't think you have severe because your pain start to go down. So it's either you have mild or moderate internal inflammation. This is very strong magnet actually. When we measured it, it was around 5 inches in between those two.
What's the science here? Is this increased circulation?
So the science very simple actually. So the cell voltage runs between like 20 to 25 millivoltage. That's a normal cell's voltage. Okay. When they looked at the inflamed or injured tissue or diseased tissue, the voltage went down 5 to 10. So think about this way, that you are running on 5% of your phone battery. You barely making phone calls. You're not able to use any apps. The same thing happened internally because cells use electromagnetic currents to communicate and to move the electrons and to move like the potassium on the action potential. He knows what I'm talking about. So it's basically cells use electricity to communicate to function normally. So the electromagnetic currents, so the idea is increasing the magnetic currents in the cells. So your body transitions from inflammation to proliferation to maturation. It's basically like a charging the voltage, increasing the voltage in the cells. If you don't have any deficiency, like magnesium B, C, D, K2, or other deficiency, the MagnaHeal should be enough by itself to decrease that, like to increase the voltage a little bit. But if you have internal deficiency, we will need to meet that deficiency while we're doing the MagnaHeal to speed up the healing process.
I have in the past had a tendency to get a magnesium deficiency.
You did? Okay, we'll check that. Let's drink some more.
I have supplemented to try to keep that from happening, but I have had magnesium.
Where American diet is really very low in magnesium. Very low in magnesium. So constant pain from 0 to 10.
I'm really not in any pain.
Okay. So let's do the motion that aggravated now.
I feel in that range. I feel tightness.
But pain. You're gonna continue feel tightness
Yeah.
because we broke part of the scar tissue. We did not totally break it down.
I've got maybe one that's focusing right there.
One.
A pain of one.
Okay,
It's
that's not
focusing
bad.
right there.
Just that range of motion. What about rotation? That's what we had issue with. 0 to 10.
Yeah, I'm down to a 1 on that.
So 1 and 1. Okay, let's go back. And the range of motion you're gonna gain more range of motion when we totally break down the scar tissue. How's the pain with this?
I'm still at a 3 on it.
Now we're trying the MagnaHeal 2 because some areas you have mild inflammation and that was enough using the MagnaHeal 1. Now we have moderate. It's gonna move a little bit, so that's fine as long as it's very strong. Actually, we measured. That's like the length of the magnetic field of this MagnaHeal 2. It's up to 3 inches deep. How does that feel?
It really feels good.
Okay, let's do the rotation.
Okay. It's feeling better. I still got about a 1 there.
But let's put the magnet right on the spot.
Okay, let me find it. I think it's more out front when I do that pronation.
How's that?
I still feel it, and it's still got a little pain to it, but it's much improved.
How much from 0 to 10?
I'm a 1. I would say a
Okay.
I'm still a 1, right?
So you probably need to wear the MagnaHeal for a few hours. Okay, so let's do the backward. How's that?
Still at about a 2, but
And
I
where
don't
do you
have it
feel
on-
it?
I don't have it on the spot for it, right?
Okay, let's do the spot, put it on the right spot and do the motion. How's that?
I'm still about a 2 on that.
Okay, but we started with 7 on the
Yeah.
spot.
Yeah.
So-
It hurt just to even move my arm back there. I know I still don't have a lot of flexibility, but it's not hurting like it was.
So now you feel the pain only when you add the end range of motion?
Yes.
Before you felt the pain while you're going toward the back, is that correct?
I didn't even have to move and I felt it.
So it
when
was-
when I moved, it really
So,
accentuated.
okay. Well, that's a good sign. So now we know that you have moderate inflammation, and usually take, because you start to feel pain relief with the MagnaHeal too. Moderate inflammation, some patient could take them a few hours, other patient could take a few days. You wear it throughout the day to decrease that inflammation.
2 hours.
It depends on how you feel. Wear it for 2 hours, take it off, your pain gone, you're good to go.
Okay.
If you still feel pain, keep wearing it. You know, I strained my biceps and it took 2 hours and I took it off. My biceps was fine after that, I'm done. But if I start to feel like there's more inflammation, has not been healed totally, even sleep with it.
Okay.
You know, I will show you other way of strapping it that does not fall for your shoulder
Okay.
after this video. So you had physical therapy, chiropractor, massage, surgery, stem, infrared. So what do you think about ASTR treatment? We did it for this session.
You know, I told you I'm here because of desperation.
Yeah,
I'm encouraged.
yeah. So
And I've been wondering if it was going to improve. And
Yeah.
I already feel improvement.
you feel improvement? Okay, that's good.
So
Yeah, you keep moving it. That's good.
yeah, it's going in the right direction.
That's-
I haven't felt that in a while, but
That's
it's going
good.
in the right direction.
Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.